All right, so these are stories that typically don't get covered much because they're not really palatable to a lot of audiences. Also, of course, like the mainstream media is not going to report on this because they don't want to tick off their advertisers, which are private health insurance companies. So this is really cool. We've got two back-to-back stories here, okay, that I want to inform you guys about. So this comes from the Yale School of Public Health. All right, we're talking about Yale University here. This is a study that has come out. It says a single-payer universal healthcare system in the United States would save over 68,000 lives and more than $450 billion annually, writes Yale School of Public Health professor Alison Galvani and colleagues in the current issue of The Lancet. Now, The Lancet is one of the oldest and most prestigious, all right, medical journals in all of existence, all right? It's like serious stuff, hard-hitting stuff, okay? So Professor Galvani has a PhD, of course, and she is somebody who has a PhD in, I believe it's epidemiology, so, public health and all that good stuff. And so I'll read you the summary of this, all right? It says, although healthcare expenditure per capita is higher in the USA than in any other country, more than 37 million Americans do not have health insurance, and 41 million more have inadequate access to care. Efforts are ongoing to repeal the Affordable Care Act, which would exacerbate healthcare inequities. By contrast, universal systems such as that proposed in the Medicare for All Act has the potential to transform the availability and efficiency of American healthcare services. Taking into account both the costs of coverage expansion and the savings that would be achieved through the Medicare for All Act, we calculate that a single-payer universal healthcare system is likely to lead to 13% savings in national healthcare expenditure, equivalent to more than US $450 billion annually, based on the value of the US dollar in 2017. The entire system could be funded with less financial outlay than is incurred by employers and households paying for healthcare premiums, combined with existing government allocations. This shift to single-payer healthcare would provide the greatest relief to lower-income households. Furthermore, we estimate that ensuring healthcare access for all Americans would save more than 68,000 lives and 1.73 million life years every year compared with the status quo. So the highlights of this are that it will lead to a 13% savings in national healthcare expenditure equivalent to more than $450 billion annually, and that and also that the entire system could be funded with less financial outlay than is incurred by employers and households paying for healthcare premiums combined with existing government allocations, and then that it would also provide greatest relief to lower income households, and then finally that it would save more than 68,000 lives and 1.73 million life years compared to what we have right now, which is amazing. So this is a paper, of course, posted in The Lancet, again, one of the most prestigious, if not the most prestigious, medical journal, by a professor from Yale. So very serious stuff here. This is really awesome, of course. So again, anytime you're getting into debates about Medicare for All, don't forget about this. I'll be sure to link this in the description box so you can use this site. This is one of your sources. Now, here's the other one. This is huge. So this says, second largest doctors group in U.S. endorses Medicare for All public option. So this is crazy. So they endorse both Medicare for All and a public option. And so this is huge because if doctors are saying this, that's massive, right? First of all, a lot of people will talk about, it's going to bring doctor pay less or whatever. So if doctors themselves are coming out saying we support this, that's a massive change. It's a huge change. Huge, huge, huge. So it goes on to say the ACP, which represents internal medicine doctors that often serve as a patient's primary care physician, is known as more liberal than other groups, including speaking out forcefully against the repeal of Obamacare. So if you don't know what a primary care physician is, your PCP is like, your main doctor that you have for like your checkups and all that stuff. And you're supposed to have everyone's supposed to have a PCP, a primary care physician, and then you're supposed to go to, if let's say you have some special problem like a GI tract problem or something like that, you talk to your primary care physician who then reroutes you to that GI specialist, and then that information you get from the GI specialist, whatever testing you do, whatever, then that reroutes back to the PCP, and it's basically all of your info and all of that is there, and so you go for your checkups, go for, cancer screenings, all the routine stuff you're supposed to go to your PCP for, okay? And so, like Dr. Mike, for example, from his YouTube channel, basically explains that, people need primary care doctors because that results in less healthcare issues, right? So if you have people going to their primary care physicians for checkups, for, things, whether it be getting vaccines or whether it be, early cancer screenings and just all of this different kind of stuff, right? All this early detection that exists, and basically doctors, examining, giving advice and all of that stuff, that makes it so that you prevent ER visits and all of that kind of stuff. And so you lower all of that, and so it lowers the total cost, obviously, and it makes, the country healthier in general. And so that's why PCPs are like, we need Medicare for all, because we want patients to have insurance so that they're able to come get checked out, so that we can help them prevent them from being in a horrible condition, from getting into a position that could have been, it could have been either delayed, or it could have been, completely just avoided, some like early cancer screening or whatever. Oh, look, you caught it in stage 2 or stage 1 instead of going to the ER at stage 4 to metastasize, and now you're going to die, and so that's why PCPs are, I guess, in favor of this kind of stuff. It says, currently the United States is the only wealthy industrialized country that has not achieved universal health coverage. The group said in a paper laying out its position, the nation's existing healthcare system is inefficient, unaffordable, unsustainable, and inaccessible to many. The group endorsed both full-scale single-payer healthcare insurance and an optional government-run plan as competing options that can both achieve universal coverage. There are also signs that doctors overall are becoming less opposed to Medicare for all, which traditionally has been opposed as leading to cuts to doctor payments. The American Medical Association's House of Delegates came close to voting to overturn its long-standing opposition to M4A in June, with the vote falling to 53 to 47%. So it's gonna keep going down. You know what I mean? And this is going to be very, very crucial, of course. So it says, we believe status quo is an unsustainable model for our country and most importantly our patients. And so when doctors are speaking out, you have study after study, Mercatus study, now a study in the Lancet from a professor of epidemiology with a PhD in epidemiology, explaining how by their calculations it will save us money, lives, and years of lives. There's not really an argument to be had now, because the facts are just so overwhelming that you really have no choice. And then most of the time, people who are on the opposite side are going to have ulterior motives. They're going to be funded by the private health insurance industry, vast majority of the time. And so another thing about Medicare for all that's helpful to doctors is they don't have to deal with all the bullshit administrative work and the paperwork that comes with this, because holy smokes, dude. Again, you need to understand how our healthcare system works right now, okay? So what does single payer mean? It means it's publicly funded through one route. There's one fucking payer, and that's the government, okay? Everybody pays their taxes. The government gets all that shit, and it pours it into the system, okay? Instead of like, oh, look, we've got our healthcare system with 1 trillion different private insurance companies all doing their own negotiating with hospitals and doctors, and then doctors don't know what is covered by what insurance, or whether or not this is covered, or how much this costs, and oh look, this costs this much and this costs this much from this insurance, and it's like, holy fuck. And so administrative costs for private insurance are through the roof, when for Social Security and Medicare it's like 2%, and I think for private insurance it's 16 or 32, I can't remember which one it was, but either of those numbers is significantly more than 2%. And so doctors are tired of this shit, man. PCPs are tired of this shit. They're like, I don't fucking want to do this. I want to be able to have all these people have insurance, be able to come and be healthy, and then I want to be able to, do my job without this sort of insane fucking task of all this bullshit administrative work. And, doctors have like one of the highest burnout rates, like suicide rates. And it's honestly, it's easy to understand, man. I mean, doctors work their fucking ass off, they really do. And so to make their job easier, we can implement Medicare for all. And, when we implement Medicare for all, we're going to have to make some changes as well. We want to really try to make the system as best as we can. And so we're going to work on those little tweaks that we're going to make, to try to make jobs, make it easier. For me, for example, I think we really need to incentivize people to become doctors. I'm in favor of tax-exempt status for doctors, because there's such a small group of people in the United States, and because the work that they do is literally unmatchable. I mean, there's no job that compares to saving somebody's life. Literally not even close, okay, at all. So I'm in favor of that, as well as obviously making college free, right? Making college education free, including medical school. So those would be big things that we need to do. And hopefully we can keep the doctor pay fairly high. I would like to keep it pretty high. Hopefully we can keep it at a decent amount, because we want to make it so it's not too stressful on doctors, and we need to make it so that there's enough doctors for patients, and that it's not like a job with massive suicide rate and burnout rate. But big news. So again, anytime we're getting into arguments, point out doctors support it, PCPs especially, point out that there's studies like this, and I'll make sure to leave the link to both of these in the description box down below. But really great news here, man.